I was just saying, Dr. McFillin, that what you are talking about so consistently from a place of wisdom and experience is so needed right now in the world. And I assume that you get probably a pretty wide range of feedback on some of the stuff that you talk about. If you could just start by maybe sharing your background a little bit and then maybe telling me a little bit about some of the feedback that you're getting on your content, I would love to hear that.
Sure, Sean, it's an honor to meet you. My name's Dr. Roger McFillin. I'm a clinical psychologist. I'm a executive director of a large practice in Bethlehem, Pennsylvania, practicing clinical psychologist. I'm also host of the Radically Genuine podcast and put out content weekly, speaking to experts around the globe, as well as sharing my own personal opinions on, generally speaking, mental health struggle and suffering of human beings and human behavior, and really how it's been corrupted by industry to kind of reframe the experience of what it means to be a human being, and that uh, my podcast really is speaking out against kind of the misrepresentation of the human experience, where psychiatry, the pharmaceutical industry, the medical establishment misrepresent this as in ways to kind of categorize uh, the range of experiences that someone's going to experience throughout the course of a lifetime to really put somebody on a drug. And we've gone from a period of time where, if you go back into the 1930s and 40s, I'm reading an interesting book where uh, community-based samples, about one in over 1,000 people would ever identify with going through what we call depression in a given year. You fast forward to your 2024, and approximately one out of every four or every five identify with going through depression. Now, is everyone going through depression? No, it's just a complete misrepresentation of what that experience is. And it is now an umbrella term to identify any negative emotional state as clinical depression, which has the secondary purpose, obviously, of driving more people into seeing their doctors and leaving with a prescription, which has allowed that to be $1 billion industry. But I follow the data, and what the data suggests is everybody's worsening, and has been since we've started to, introduce psychiatric drugs as a way of dealing with emotional distress. And so I pretty honestly, radically, genuinely share my opinions about what it actually means to overcome challenges in life, and actually how necessary it is to be able to experience emotional pain and struggle, and how that drives creation and positive change. And going back to your question about the range of responses that I get, obviously, it's as varied as people's consciousness is. So, there'll be people who think I am, a heretic, and just speaking out of line and talking about things that are essentially going to be harmful to people who are really struggling, all the way to the other end of the spectrum where, this is kind of refreshing content where people have been thinking it for a long time, and I'm kind of putting words to it, and it's starting to make sense to them, and it's pulling people out of the medical establishment and getting to think about things a little bit differently. I think we're seeing a movement of hard patients around the globe, and those harmed patients from decades of psychiatric drugs, or sometimes even just months of psychiatric drugs, are getting people to wake up, that there's a lot of adverse consequences to taking these drugs, and even identifying with this idea of mental illness in the course of one's lifetime has really negative outcomes. And so I think I get the comments back. They're really in a range of where people are in this issue. Some people are still asleep, which they're just absorbing kind of the messages, the cultural messages that have really been, promoted to us since, for some people, since the day they were born. I'm a little bit older, so I remember a time where pharmaceutical companies did not promote their product to the American public. I remember a time where mental illness or mental health problems was rare and episodic, and you certainly didn't go to your doctor to get treated. So I see the shift over the course of like a 30, 40 year period.
What a great place to start. Yeah. Well, what you're doing is super courageous in my mind, and I think I shared with you when we first connected. Um, you know, No, I'm not even gonna go down that path because I have 1,000 questions and 1,000 topics I want to dig in with you. But I am curious about when your sort of red pill moment was.
I get asked that question often, and it's hard for me to answer as if there's like, a one situation that, allowed me to wake up. I can tell you this: my first job out of undergrad, I was working at a children's psychiatric hospital. I had no background at all in mental health. I didn't know I wanted to be a psychologist. I played college football. I thought I was going to be a college football coach or a high school football coach and a teacher. Um, because that's what I knew. Those were the most important people in my life were my coaches and my mentors, and I wanted to have an impact on people. So I started coaching football, high school football, and I took a job at a children's psychiatric hospital. And what I saw there was absolutely frightening. Kids who were as young as age 5 being placed on multiple psychiatric drugs. Most of those kids came from really abusive or neglectful environments. So they'd act out physically, or they had, post-trauma symptoms or so forth. They'd be given all these labels and then placed on a number of drugs that would, the ultimate goal was to kind of sedate them. And it was during an era, this was 1998 through 2000, where it was still quite new, this identification that emotional struggles of living and the challenges of living could be reduced to a brain disorder, and that you could treat it like insulin for diabetes. So it was the beginning of the narrative that was kind of pushed on Western societies. And it was a story of scientific breakthrough and progress. And what I observed at that time was kids deteriorating. I mean, I'd see kids come into the hospital, they develop side effects, become more aggressive, sleep 16 hours a day. And so it was very clear to me that what a positive outcome for psychiatry was a kid whose emotions and spirit were kind of blunted, and then they would leave the hospital and go right back to the same environment that they were in. And so I knew it right there, in my heart, in my soul. I knew that just taking a pill is not the answer. And so throughout my career, I decided to continue. I got a master's degree, went and got a doctorate degree, worked in many settings, and I was exposed to the harms of these quick diagnoses and drugs and quick fix. And I've seen it, how it's been really promoted to the general public, and post COVID, it's been worse. In probably somewhere between 2016 and 2020, I was doing a lot of research into how antidepressant drugs came to market, their safety and efficacy. And by the time 2020 came and hit us with post COVID, and they were kind of pushing similar narratives about going to get a vaccine, at that point, I was extremely awake to the pharmaceutical misrepresentation of science, the marketing messages, the brainwashing, and I was seeing it unfold in our country. And that's when I decided that I got to get on a microphone, and started the Radically Genuine podcast and started a provocative Twitter account. And since I couldn't sleep at night knowing what I know, if other people were going to fall down the same kind of path. And what we were seeing is like dramatic increases in people going to their doctors during COVID looking for a psychiatric drug. And so the consequences of that were a mental health crisis for young people for varying reasons. But in my opinion, the primary reason why young people were struggling during COVID was also how we were responding to the COVID crisis. So we know about the isolation. We know about pulling kids out of school and activities, the masks, so forth. But then when they would inevitably struggle and they'd go to a doctor, they'd write them another prescription, for a drug that's never been proven to be safe, that's going to be more than double the risk of a suicide event. And so what do you see? You see these dramatic increases in self-injury and hospitalization. So I started to speak out. No red pill moment. It's like knew it in my heart. The whole thing was a marketing narrative. I used to laugh at the idea that someone's wife could lead them. They'd lose their job. They'd start drinking. They'd all these problems, and they would go to a doctor and say, "Hey, you have major depressive disorder. Take that pill." Instead of solving the legitimate problems that existed. And the more it got pushed on the kids, is the more protective I think I became as a professional, and just became more outspoken.
Well, thank you for that. Thank you for that. Yeah, this is better health a scam?
BetterHelp is definitely a scam. If you listen to their commercials, I mean, it's so out of control right now. is that you think that, any challenge that a person experiences in their life, that the solution to that is getting on a call with a stranger and talking about it. So, I mean, it's commodifying emotional distress, and it's putting it into like there's only a couple avenues that exist to be able to overcome anything that someone's going to be going through, and that's like therapy and a drug. And that in itself is ridiculous. But what certainly is happening is we've kind of medicalized normal. Shyness becomes social anxiety disorder. Um, Being out in public and experiencing any form of like anxiety is now like a disorder to either drug or see a doctor about. Anytime you're having trouble focusing on something, regardless of what the content it is, now you have ADHD. The word sad is pretty much gone from our cultural lexicon. We've
Mm.
lost our ability just to kind of communicate the normality of struggle and suffering, which leads people to kind of turn inward and judge that experience as if it's wrong. And then you have to go seek out an expert for some type of label and path to, overcome it. And people don't even understand that there's harms to any intervention, just like there's harms to a medical intervention. There's harms to psychotherapy as well. You got people now who are relying on a stranger to kind of go over any type of problem that exists in their life. I mean, we could see people who are in therapy for years. It just becomes an extension of a way of coping that doesn't lead people to kind of overcome it. And you kind of get stuck in this kind of strange matrix when you spend too much time with a therapist, right? Like, because you have to, what I'll say to my clients, and listen, I do therapy myself, but what I'm clear about with people is that if what they're going through can be recovered naturally, without me being involved, I often make the recommendations. I don't think you should be in therapy. Well, what happens when it becomes an industry is that's how people make their money, and that's how people support their families. And therapists aren't really incentivized to say, hey, I don't think you need this. And then you hear the nonsense like anyone can benefit from therapy at any single point in time, not understanding that kind of what we put our attention to like persists. I had a gentleman this week who initially came into me. He was kind of stuck. He was in a rut. And I've worked with him previously. He had a pretty significant trauma event in his life. And so we kind of identified what the problems were, started facing him. He started overcoming. He was doing well. I don't think he needed me anymore. He came for one final session. I could tell he was like trying to create reasons to kind of stay in therapy or just create problems just to talk about. And then that's the problem with an industry like BetterHelp, right? Like they're beholden to their shareholders. They're trying to make a lot of money. So therapists are going to be really good at generating content to talk about. And so now you're restricting somebody's attention to focus on the problems that exist in their lives. And in the worst case scenarios, it's like a repetitive, obsessive rumination that can get created in the process. So generally speaking, therapy should be rare. It should be for people who are really suffering, need some professional help to get unstuck. And it should, in my opinion, be skill-based, goal-focused, and rather short-term.
Mm.
And that's not kind of what it is anymore. Now it's pushed for it's pushed for the commodification of the entire process. And so I don't think people know what's normal anymore, Sean. I think like I grew up knowing that I'm going to go through some down periods in my life. I know there's going to be some struggle, but luckily I had some really great parents and people around me who kind of normalized that process as something to kind of learn and grow from. And so
Mm.
I take a look at situations that people go through from a completely different lens. And especially the younger they are and they come in to see me, they're pretty shocked by that perspective because they're so brainwashed into viewing themselves as having like a psychiatric condition. And this is pushed on YouTube, social media, TikToks. People develop these brands around it. So what's fascinating to me is people kind of wanting to have a diagnosis of like mental illness.
Yeah.
Um, almost in some ways to like to justify why they're not living the life that they believe they should, or maybe others should, or sometimes to even just be part of a community. They feel so isolated, and they want to be able to kind of provide themselves this disability status and be connected to a community. It's a big shift generationally. You speak to my grandparents' generation, the baby boomers, World War II generation, or so forth. Like the idea that you'd want to be labeled with a psychiatric diagnosis is just, insane.
Yeah. Yeah. Well, obsessing on your limitations is fairly unproductive. And when you ask a barber if you need a haircut and they say, yeah, you need a haircut, you need it, you need 4 haircuts a week.
Mm.
You need to be coming in and getting your haircut for the next 6 years. Um, that all sorts of red flags come up. And in the work that I do as a personal coach, I have demonized therapy probably unfairly, but in my mind, not really. I've met lots of therapists in my line of work. I've met clients who have been working with therapists for a long, long time, and I've met two that that I thought were doing a good job, that were actually going somewhere. And the way that I think about it and is therapy is looking back. It's an understanding. Obviously, processing trauma is extremely useful, and we don't have the tools, and we need some help with that. That's great. What I do as a coach is I look forward. Like, what's the plan? What are you going to put in place? What adjustments are you going to make? What sort of lifestyle do you want to design for yourself? What's your purpose? What's your mission? What are the behaviors that are in alignment with where you want to go, rather than looking in the rearview mirror and just stirring it up week after week. And this focusing on mental health, this social emotional learning that's happening at my children's school. I have to, when they come home, we have to unwind a lot of that programming, like constantly, constantly. How am I feeling today? How am I a smiley face? Am I a neutral face? Or am I a sad face? And growing up with a behaviorist as a father, and understanding just the doom and the gloom and the self-obsession that comes along with social emotional learning, which is now everywhere, is stunning to me. Maybe you can speak to social emotional learning.
Yeah, Sean, I have a different perspective on this. I think it's actually nefarious and intentional.
Mm.
So I'm a clinical psychologist, study this research. I really focused on, how people overcome really challenging situations in their life and thrive. And the one thing that we know about living well is the people who are, I think, thriving in life, their attention is focused outward into the now, into creation, to activities that are in. This is extremely important for kids, right? You want kids focused on play, on sports, on music, on their extracurriculars, on their academics. You want them creatively engaging with each other. The last thing you want to do is drive your attention inward to obsess about your own experience. That's going to drive more suffering. And that's very well known. And so when it's pushed in public schools to be hyper vigilant to every emotion that you have, or to label every emotional experience that you have, that's not social and emotional learning. That's programming. That's a programming to get people to be focusing not on what matters, but what they are narcissistically might be experiencing. And it takes a lot of work for me as a psychologist to get people out of ruminative states, right? The ones that people turn everything into themselves, like the world sucks, nothing works well for me. um, I'm never going to live the life that I live, and I'm never going to be develop relationships, and this darkness that we're all capable of kind of falling into. To push it into schools and young people, and what happens is it comes with that narrative too, right? Like the narrative that's been pushed by the medical establishment, the psychiatric establishment, that ultimately drives people to turn to drugs to change their experience. So there's something around that language, like when you start talking about depression and anxiety in terms of like it's an unwanted experience that you have to be aware of and you need to do something about, like taking care of your mental health, right? What does that actually mean? Well, in their world, it means go see a professional. In their world, it means take a prescription. In their world, it means go and talk to somebody that's outside your family that's a professional. And
Mm,
it's driving people into those and down that path when really we want to be talking about resilience. If you're going to do anything in school, you want to talk about, uh, life is hard sometimes, and there's great meaning attached to it, right? And you're strong, and you can get through it. And there's a lot of things that are important for our well-being in life, and that can range from our exercise, the way we move our bodies, to what we put into our bodies with food. Uh, the way we treat other people, how we cultivate relationships, all these things that you can really focus on that are, I think, valuable for young people, um, is now being compromised. I think it's being compromised by an agenda that loves to push like identity-based politics, that likes to divide people, that likes to get people to like adhere to a specific political agenda. And that's why there's so many social engineerings around this. And I'm very vocal about, parents making sure that they are attentive to what is being taught to their kids in public schools. The Biden administration has recently dumped a lot of money into what's called school-based mental health clinics. And in the state of Pennsylvania, is the state that I'm in, and I think most states it's probably around a similar age, that a 14-year-old can consent to mental health treatment without a parent's permission. 14-year-old mental health treatment means they can go and get a psychiatric drug without their parents' permission. And you push that into schools. And now taking care of your mental health means going and talking to somebody, getting another label, and being offered those drugs if you're going to put a psychiatrist in those schools, which is part of the plan. And so I think you have to be extremely vigilant, parents, to make sure that your school, which is local, which you have control over, who you vote into the school board, attending school board meetings, being aware of the curriculum. We're sending our kids to public school to learn math, science, English, so forth, right? Um, the other things I want to take care of, when it comes down to my kids, their morality, the type of their character, that's my job as a parent. When it comes to their mental health, that's what I want to be a part of, right? I want to be able to create the narrative for my children on what it means to go through life. And that's, connected to our faith, but it's also connected to everything know about human resilience. I'll never look at a downtime in terms of a medical diagnosis. I'm not looking to label it. We're looking to understand it and overcome it, and validate it as a normal process in life. So I have zero trust for what our public schools are doing. It's an extension of big government. It's being pushed at the federal level. I've even seen some localities like pushing these mental health apps, which is the dumbest thing. You're going to push kids to screens,
right.
which is the most detrimental for kids' mental health. The more you drive kids into screens, social media, and so forth, I mean, it's that same process, that same ruminative process that I said before. You're getting them to focus on things that don't matter. We want
Right.
to get our kids to focus on things that do matter.
Yeah. Yeah. I see it. And so my kids are 11 and 8, and some of the conversations happening around mental health and people, um, 11-year-olds, 8-year-olds talking about their mental state, obsessing about their mental state, using canned language that's part of the programming is so alarming. And, these little kids are kind of raising each other, they're learning from each other, they're understanding what's cool and what's not, what's a social norm, what's not a social norm, and the social norms that are coming from this elevated conversation around your mental state, it goes nowhere. It's so degrading to um um, healthy lifestyle, healthy thinking, self-diagnosing yourself as depressed on TikTok at 11 years old. Um, it's just it's super alarming. And I think that there is going to be, with this generation, I think that there is going to be a major distinction between the kids who are drinking that Kool-Aid and the kids that aren't, the kids that are playing sports and focused on activities and um your church or your groups that you're a part of. I think that there is going to be a major distinction between those two types of kids. I I want to dive into a topic that I've hinted at and sort of spoken around for a while. That's a little provocative, which is mental health and sort of the trans emergence, and gender dysphoria and this type of thing. Because again, I see it on my block, I see it down the street, and it's super alarming to me. Is there a connection between what we're talking about and the trans agenda?
Yeah, I think so. I think when you deep dive into this, because it's a cultural phenomenon that didn't exist previously. So if you just kind of look at historical data, the chances in the 1990s that you would run into or know anyone personally who considered themselves transgender was quite rare. And when it did occur, it only occurred in predominantly males. So we almost never saw females who wanted to identify as a man. We never saw cross dressing and females dressing as man, but there was that phenomenon in a very small amount of people, which were generally men. Like sometimes it would be identified as like as early as being a toddler, but again, extremely rare. And what you see is what's called a social contagion. Social contagions have been around forever. It's a very well-known psychological phenomenon. One of them existed in the 1990s around eating disorders, is that we saw a large uptick in like anorexia and bulimia as models' body image shifted to a more thin body ideal. And with the prevalence of media in Western worlds, like promoting that as an ideal body image to females, a social contagion started of anorexia. And as like social media and internet started to grow throughout the 2000s, you would see that expand. So whatever you are exposed to frequently is a creation of consciousness. Now let's go back to teenagers. The one thing about being a teenager is it is a time of distinct identity development and a lot of vulnerability. Traditionally, generations had a lot of patience and acceptance for the mood shifts and the difficult times of being a teenager. It was normalized. Now, in identity politics, the division that exists like throughout the United States, things start getting pushed for whatever reason, right? And a trans movement starts to develop like in the mid 2000s. And it seems like it's kind of an extreme radical social movement. But the more that it gets pushed on social media, the more it becomes part of our cultural consciousness and it gets discussed on major news networks and television. It in itself, again, is created as a cultural consciousness. And then when you start discussing it in front of young people and you start changing the way that you view gender, and in academic institutions, it was like the identification of pronouns. Like even if you were, you know, a heterosexual male like myself, I'm married with 3 kids and I'm 48 years old, somehow I'm supposed to put in my social profile or on my signature of my email like he him, like as you wouldn't know that, right? Like anyone could be anything at any given time, and that's part of like the collective brainwashing that exists. Now you combine that with a culture that certainly has like this Marxist roots that are developing. And what is Marxist roots? It's like it's pitting um, the haves versus the have-nots, the ins versus the outs, right? It pits people against each other. That the only reason somebody would ever achieve any sort of status in life is because of like their inborn characteristics. And so whether it's your skin color for the most part, or it is the majority culture, the only reason anyone achieves any form of success is because they were born into that majority culture. And what that does is it ultimately breeds a sense of like shame for having success and being of the majority culture. And you see these vulnerable white kids um, who are going through normal developmental shifts, wanting to identify of having some minority based status, and that whole trans movement, which is being pushed as like this is a minority status for to be praised and to be reinforced. Maybe a lot of these kids are struggling, they don't have their own group, which has always occurred. Like even you looking back 30, 40 years, there was always kids who were on the outskirts who didn't feel like they had any belonging. Now you have this new sense of belonging by just identifying with a different gender. It's confusing to them too, especially if you have a background of being bullied. Maybe you're on the autism spectrum. God forbid you have a traumatic experience. You're growing up hating your body, especially if you're a female, right? There is this normative aspect in development for females to go through kind of this body dysmorphia because their body changes rapidly post puberty. There's rapid boys' sexual development who put attention on the girl's body. So there's always been this normative kind of like dissatisfaction that exists with female bodies. So you combine all that, like those social pressures, the shifts in societal culture with kind of this Marxist conditioning into schools. The internet grows and social media continues to kind of push these narratives. And what you have is you have this dramatic increase in um, in females who are experiencing gender dysphoria and now saying that they're no longer identify with their biological sex. And that's kind of, in my opinion, that's the source of a rise in this rapid onset gender dysphoria. Now, it's been going on long enough that we can follow them into their 20s. And in the medical system and in the mental health industrial complex, when this happens, it hasn't been viewed in terms of something to work through or a cultural phenomenon or a manifestation of other psychological problems. It's been affirmed as if it's real and even pushed people into medical transition. So young people being pushed on the puberty blockers or other hormonal treatments to alter their development, a mass experimentation on the human body. And we see them in the 20s. We have like a large contingent of detransitioners who feel like they were taken advantage of during a vulnerable period of time. And so obviously it's a cultural phenomenon when you see such a dramatic rise and there's so many various complex factors that are interplaying with it. Now, I think there's room to question other things. We're in this big movement now with Make America Healthy Again. And there's the identification of like our food source, chemicals, what's being placed in our water, has been going on for decades that has led to chronic illness. But there are some chemicals banned in other countries um, that are part of our food source in processed food that target the endocrine system. And so, what happens when you expose developing teenagers to these endocrine disrupting chemicals, and what are the downstream consequences? Same thing with the proliferation of SSRIs. What happens when you start mass prescribing SSRIs, which are targeting serotonin, and serotonin has a bidirectional relationship with the endocrine system and sexual development? So it's a complex social and biological issue that I don't want to sit here and just say that there's one cause, because I think there's many causes. I think there is a feminization of even men in our culture. So you're seeing these decreases in testosterone. We have looming fertility crisis with like a pretty dramatic decrease in sperm. So I think we can look at this as like multiple potential causes that are going to play itself out. And until we restore health in our culture, it's going to be difficult to understand all the factors that contribute to it.
Yeah, that was so well said. Yeah, when you lump on that confusing, challenging pre-pubescent and post-pubescent process, and then you layer on these dulling medications that make it harder for you to make sense of who you are and what makes you happy, and that makes it expedites or reinforces that that process to just dig even deeper, and you have less and less energy to make changes. You're more confused, you're more dulled, you're staring at a screen, and you're medicated, and you're confused about your body or whatever, going through this hormonal, flush. And it's spooky, man. It's really alarming because those little people are going to grow up to lead the next generation, and they're going to make decisions about society and politics and farming and education, and their whole worldview has been just terribly stunted. Their ability to think through things and to feel through things has just been so stunted. um yeah, we're on the same page there, obviously.
I feel like we're in a cultural inflection point. Like it's somewhat dystopian what is happening. There's kind of a transhumanism movement that exists from kind of global elites that have this very negative viewpoint of like human evolution. Like I say it sometimes on my podcast that we're almost treated, I think, in their eyes, like we're parasites. Like there's way too many people on the earth, and I'm really concerned about what can be done through technological means to try to alter our own evolution as human beings. And also, there's a depopulation movement that's existed for quite some time. I mean, even dating back to the 50s and 60s, a lot of things that things that people don't know about is
Yeah.
like hormonal birth control, for example. Its first inception into American culture was concern for overpopulation. And
Right.
I can't remember. I don't know exactly how many people were on the planet at that point. 3, 4 billion. What are we at now? 8, 9 billion people on the planet. So, like, if there was a concern for overpopulation by people in positions of power, then what is that viewpoint? Now.
Right. Eugenics. Yeah, depopulation agendas, the useless eaters. And if you see, if you are in the top 1% of 1% of power and control, you're going to look at people and humanity as a commodity. How can we extract the most value out of this person? Well, let's make money on their illness. And that is just so obvious to you and I. And I don't think that it is for everybody else, that there is a capitalization on our loosh, on our health, on our spiritual energy, that's just an extractive process that's now beginning so young. And confusion. Yeah, I think the when things get squirrely, right? Rome falls, and up is down and left is right, males are females. The humanity starts to get stripped away, and it's easy to just check out. I think it's easier and easier to just check out.
Yeah, you made a good point about emotional blunting. And that's my concern, because if anything's going to happen from these psychiatric drugs is they're going to induce a degree of emotional blunting, right? As if your human experience of negative emotions is something to rid yourself up of. But those who are really smart, those in the top 1% of the 1%, know it's those exact human emotions that are used to resist injustice and tyranny. So if you take drugs that are going to induce emotional blunting and apathy, you're not going to rise up
Right.
against the 1% of the 1%, and there's benefit for them to create a, a, a global community or a country like the United States to kind of devolve into depravity and create mass chaos, because that's where revolutions occur, where governments are able to take more and more of individual freedoms. And that's what's happening now. It's like pisses me off, because what we're doing is we're arguing against each other, where people in power continue to strip us of our own freedoms and liberties. Uh, there's just mass distraction on issues that don't have great value, while the really bigger questions about where we're going to be as a country and as a culture are ignored. Where are we going to be in the United States when we have the degree of debt that we, currently have? What are we doing to our future generations? What's happening right now with inflation and what it costs just to be able to get by every day? And the fact that they're the ones who are printing money and they continue to tax more and send it outside of our country. Our borders are wide open. There's more crime. There's more mental health issues. There's more drug abuse than any other point. We have chronic disease, and we're arguing, between these two parties. And in my opinion, they're all one and the same, unless you have somebody who is like willing to come in and really undo the entire system. And the system, feeds off of itself. That large federal government just gets bloated and bloated and bloated. And where in history do we find a period of time where someone's willing to give up more power?
Right.
You give somebody power, not going to give it back to you, right? And
Right.
we're in that. That's why I think we're in this inflection point, and people don't always see what's behind the veil, because I think it's too scary. You know,
Yeah.
you kind of like the predictability of one's life. Uh, Everything that is presented to you from the media or through the government becomes your collective truth, and it makes everything more predictable and safer. And I think it's a challenge for people to question some of these things. That's why they want to block it out. I want to trust the authority. I want to trust my doctor. I want to trust my politician. They have my best interest in mind, despite the evidence that demonstrates that none of that is true.
Right. Yeah, this is a theme that we've touched on this podcast a number of times with a number of health experts, from Rob Wolf to Paul Chek to Sean Baker, which is, if you don't, if from a health perspective you're not vigorous and capable of high levels of energy, if you're not rested well fed with nutrient dense food, you know, water that doesn't come out of your tap, with nutrients in your body, it's really hard to exercise effective discernment. It's tough to read between the lines. It's challenging to look past the narratives, to have that drive to see the world for what it really is. It's and it's and I'll take it a step further. This process of becoming vigorous and strong and unfuckwithable that starts when you're a child, then you are just blown in the wind and taking whatever you're told and going with the flow and being a sheep. And that's super common. And what happens is that your spirit degrades, your soul degrades, your ability to think for yourself, to fight back against tyranny, to beat the drum of truth. It gets really, really hard. And so, starting with vitality, starting with making sure you've got lots of gas in the tank, that you're vigorous from a health perspective, mentally sharp, well rested, that is a knock on, that's way upstream from seeing through bullshit. And even downstream from seeing through bullshit is talking about it and shouting from the rooftops, like, this is not okay. This is where we're headed, is not, it doesn't go anywhere productive. There's no joy and love if we stay on this process, and it starts with health. And I think, fortunately, what the scandemic provided was a lot of people to just, like, I can't ignore it anymore. Sean has been right. I went really hard, and I've been banned on YouTube a number of times, and I've been just uninvited to Thanksgiving, and been a relative pariah in the sort of biohacking bubble. And you and I have, crossed paths. I've had Alex Zek on, and so we speak the same language. But for some people who were kind of on the fence and thought, man, I don't know if I want these treatments. Ugh. It's at a point where you can't ignore it anymore, that the writing is on the wall. And do you have the guts to stand up and talk about it and have conversations like this that are revealing, but way upstream from that is, do you have the vitality? Do you have the energy to embark on this important mission?
Yeah, well said. You're talking about like the importance of health across the lifespan to be able to serve a greater spiritual mission. I think that's one of the things that happens when you become kind of detached from uh, a bigger picture. Um, you get detached from the kind of your faith or religious communities or stories from elders, things that like really maintain a thriving culture, is that it's passed down from generation to generation, and you understand that life is time limited and we're going to be gone one day. But what remains is what you stand for, who you are as a person, what you've created during your time here. And fear is what those in power use to control. It pushes conformity. It pushes people following rules, even though it might be those rules might be outside of what their spirit or their conscience is like telling them they should live. And so I think part of our spiritual journeys is that we have to be able to face fear and overcome it. And that's what's happening in the mental health field, is that you just see an overwhelming amount of people who struggle with the feeling of fear. They mislabel it. They say, my anxiety has come back, or they enter into behaviors in response to their own fear that cause more problems: drug abuse, overeating, eating disorders, uh, social isolation, things of that nature. And we see the consequences of that, and then it gets labeled from a medical system as if it's a medical disease. When someone like me wants to understand kind of more of what those root causes are, and to take that wider lens and see a person's life within that journey, and even those low points, low vibrational states that we're all going to be in, they serve a greater purpose. Like there's a polarity to this experience. There is no high all the time. There is no high vibrational state all the time. We have to get really good at dealing with low vibrational states. In that, though, is a very meaningful existence. If we change the manner in which we communicated, let's say the word depression, if we changed it from a disease, instead, we talked about it as a transformational experience. What it does is it changes everything. It becomes something that people grow through. It eliminates the entire drug market, obviously, and probably eliminates most of the mental health market. And people in power are unwilling to do that, um, because everything that they've learned to be true and everything that has supported their own careers would be at risk.
Right.
And so that's a big institutional change, but we have to evolve through it. And so it's a changing of the language. It's a changing of the way we speak about emotional challenges. And that's why I'm concerned about what are our kids exposed to when they go to elementary school and their social engineering, when they start talking about these things as symptoms, instead of like natural states of energy in response to events that are happening in your life or something that's going on internally. So we're kind of handicapping them. And then if we put them on drugs with these labels, we're also creating a consciousness of who they are. You see so many people come in with this idea that they're somehow broken, there's something wrong with them. And if they feel a certain way, somehow that's a good sign or evidence to suggest that they have this disorder, when a lot of times I want to say, you're normal. Like, this is what normal is. But what's important is, what are you going to do now? Right? How do you
Right.
respond to this point in your life? And that's why I think the best psychologists are the ones that, help people solve problems, face them, overcome it, see it as episodic, time limited, and, understand that you're going to recover on this naturally. You may need some tools right now, uh, but you're gonna learn and overcome it because it's in your DNA.
Yeah.
The only reason you're here is hundreds and thousands of years, maybe millions of years. Your ancestors were able to survive long enough to procreate. They're the best of the best.
Yeah.
And so now we're thrown into this area of our culture where, it's so fear based. I was watching some baseball games, game 5 of the Mets and the Brewers last night, and every other commercial, some pharmaceutical commercial that's pushing fear. You have to get this test. You have to get this vaccine. You have to get this intervention. Like, it's constantly a fear-based approach with the underlying message is there's something wrong with you. You need to get a medical expert to check it out. And then you need to use our product to be able to save you, which is all bullshit, right? You're naturally designed to heal. The only way you're not going to is if you're going to expose yourself to toxins and live a lifestyle that a human being cannot thrive in. And then if you follow their worldview, then really, what is life? Life is all constantly worrying about your own mortality, your own sickness. It's a sick care mindset. And that in itself is going to breed sickness. You're going to worry about your mental health. You got to take care of your mental health. You got to go to this doctor for this screener every year. You got to get this. You got to get this. At 45, you have to get this. It's just nonstop messaging that has just driven us to illness and sickness. Where we're the richest country in the world, and we have one of the worst healthcare outcomes in the developed world. Our entire population is unhealthy. Like, what else do you need to wake up? Like, I
Yeah.
don't understand at this point. If it's not this, then what is it going to be?
Right. Right. Yeah. So and it's part of my mission with this podcast and the coaching work that I do is to introduce week after week what are some alternatives that you can explore, like getting into an ice bath or walking barefoot in the grass or you know, nutritious food or making sure that you've got great sleep. Like that's a better place to start than a chemical intervention that is going to destroy your organs, dull your senses, and put you on an everlasting loop until your dying day of relying on so-called experts that are going to extract as much money out of you as possible. And if you just went for a walk and fasted for a day, you'd probably feel better. If you got a hug, that's going to help a lot. If you focused on what you're doing rather than what you're being, that would be really productive. And even as I say that, there's a little bit of a catch, right? Because I believe that self-awareness is important. You know, um, developing um, an ability to sort of orient yourself in the world and understand how you're feeling, and having that self-awareness is really important. But I don't know, is there a fine line between self-awareness and self-obsession? What do you think?
There's a distinct line, and I'll use different language. So instead of cultivating self-awareness, I want to cultivate an observational stance. So what that means is we can only live in the eternal now. The now is all that exists, right? The past has already happened. To go there, you'd have to go mentally into a time that's already happened. We have the capacity to do that. There's no such thing as a future, right? Future would have to be created in the mind. So past or future is removing yourself from the now, the only now that you live in. So when we talk about tools, what I'm interested in is what is the first thing that people do when they wake up? Because where their attention goes and where their mind goes tells me about what they worship. And what you worship is where your attention is going to go, is what you're going to create. So you go to your phone, you are checking your email, or you're going to social media. It gives a good idea of what's most important to you. And what dominates your attention is going to be cultivated in your reality, your existence. We are creators of our own reality. That's very scary for people to kind of realize, but it's very important that most of what we're living in is our own consciousness, and that consciousness is created. And then from there, we enter into our physical reality, or we manifest things into our physical reality. So the things that I think are most critically important is your first thing in the morning should start with some form of gratitude practice, right? So is your mind focused on what you don't have? Is your mind focused on the next worry or the next thing you need to do? Or is it attentive to everything that does exist, what you do have? Because that's gonna be an energy shift in you. Like that's gonna be a shift in mood. Because already you have enough. You can walk, you're not in a wheelchair. That's a blessing. And you're not going to really miss your legs until you don't have them anymore.
Mhm.
But what I want my clients and the people I work with is to be aware of the things that they have that provide them freedom and provide them vitality, and you take for granted every day. And so yeah, there's the obvious things. Focus, your attention on your family and the health of your family and the things that you have. You have a roof over your head. You probably just slept in a bed. There are things to be grateful for. And that's important. So I want someone's attention to be fixated on that. And then I think like a mindfulness or meditative practice allows you to be observant of your experience. So when I'm in a session and my attention is on a client, if my mind goes to the next client or things I have to do that evening, I'm going to miss what's in front of me. And that's such a great metaphor for life. If my mind is not where it is most important, if I have not cultivated an intentional focus on the things that matter most, my mind is like an untrained puppy. It just goes to wherever stimulation is. And too many people are like that because they have an undisciplined mind. The phones don't help. Okay. Now you said, where's the distinction, right? Self obsession. Well, where's your mind? Where's your attention? Someone who's self obsessed, usually, in my opinion, is focused on their identity or who they are, their ego, or the things they don't have, or the things they want to have. That's an energy that you can focus on that, but I think it drives misery, and I don't think it drives creation of the things that you really want to have.
Mm.
That's my concern with modern therapy culture is people will go in and it'll drive a self obsession that just drives more misery because you're just over analyzing every aspect of yourself, and the therapist and the client are now cultivating a shared reality of who they are when when your reality should be cultivated by living in it, right?
Mhm.
You want to cultivate a relationship. It's not about talking about it. It's about taking those risks and meeting people, going out on a date. You have somebody. It's about working on the problems that you have. It's learning to love. You want to cultivate health. You can only talk so much about it. You got to do it, right?
Yeah.
And so I'll tell people that I'll ask them, what's the first thing you do when you get up in the morning? Because that's your religion. That's what you're worshiping. I'll tell my clients to part of my evaluation process, pull out your phone. Let me know what your average screen time is.
Mm.
Our attention is a commodity, right? And so we have to guard our minds. And so you mentioned some important things. Okay, grounding. That the health benefits are extraordinary, right? The more we get back to our ancestral roots on a lot of things, the better we're going to feel because that's how we evolved.
Right.
So connection to nature, sun is absolutely necessary. Our sun exposure, bioavailable foods, especially like carnivore based foods. Like, listen, I don't like liver, but I eat it
Yeah, man,
because
me
of
too.
what it does for me, right? What it does for my spirit, my vitality. Um, and so there's so many common sense type things about returning to ancestral roots that that it's the opposite of what the medical establishment is telling you to do. When the medical establishment wants you to avoid red meat, avoid the sun, wants to get you hooked onto screens or get you hooked onto like Netflix. They want to get you in a sick care mindset. They want you to be afraid of everything, afraid of your neighbor, afraid of a disease, afraid of catching something. That's evil. And so the tools are to kind of break free of that matrix, protect your mind, and be able to be fully engrossed in the moments that you have, because that's all you have. You only have the now. That doesn't mean that there's not opportunity for planning. We have to plan things, but that's our now. And if you mentioned a traumatic experience, first of all, 85% of people who are exposed to a traumatic experience don't develop post-traumatic stress disorder. They work through it on their own without even professional intervention. But say you are one of those 20% and you've avoided what has happened to you, or you haven't processed those memories, or you've overcompensated by protecting yourself and pulling yourself out of life because of fear. Well, that might be the time where the past is really influencing the present, and you might have to go face that. But generally speaking, the tools we need to cultivate are the ones that get us fully engaged passionately in the now.
Yes. Wow. Enthusiasm and purpose can cure just about everything. If you are enthusiastic about your life, if you're working towards something, just about anything that happens around you, with you, for you, at you, you can pretty much move through it because there is something bigger that matters. That connection to purpose. If you don't know what else to do, just go be of service in some way.
Mm.
Just go be of service. I was talking, we did a large chunk of a podcast episode with my friend Evan Britton, who former NFL player, co-hosted Hot Boxing with Mike Tyson. There was a Netflix, actually coincidentally, Netflix um documentary film where he was a part of the subject, where he was basically overprescribed Adderall, and his sort of process of undoing all of that and creating a new identity after being an NFL player for a long time, and now is just a stud yogi breath work. Anyway, so we were talking about service and how if you don't know what the first thing to you don't know what the first step is to kind of correct the course. You don't like where you're at, you're uncomfortable with who you've become, or you feel complacent or low, like go be of service. Because what happens, and we all know this, or maybe we don't because we have to keep talking about it, is when you give of service, it helps someone else, and also it helps you. This is the it's better to give than to receive. It's true, because when you do give, it does come back to you. It fills you with all of these amazing hormones. It fills you with a sense of purpose. You put a smile on your face. You're making some sort of impact in the world, and if that's your focus and not your mental state, or your um feeling low, or what your friends are talking about on social media, just about everything lines up if you can focus there.
No doubt. I mean, 100%. This is this is traditional wisdom. When I was talking before about how we've kind of gotten disconnected from religion, faith, our elders, where we are as a culture, we're kind of separated and more individualistic, is we lose these important stories of like redemption and resilience. When you say go be of service, I mean, that's something that's been written about for hundreds since the dawn of written man. I mean, it's biblically, it's spoken about. When people go into meditation or even use psychedelics, what are some of the insights that are gathered? The first thing they'll generally say is, wow, we're all connected,
Yeah.
right? So you really are, when you're serving others, you're also serving yourself. And I know when I look back at my life, what is most meaningful has nothing to do with me. It has to do with how I served in a way that created something that was bigger than just me. And I mean, that's my career. Those are the things that I'm doing, or being a father or a husband. It's in service of others. When do I feel worse about myself? Looking back in my life, it's when I've hurt somebody, when I came up short and it negatively affected somebody. That's when you feel guilt. That's when you feel shame. So any idea that like a path to feeling good in life is focusing on yourself is a lie. I mean, that's a lie that's only going to drive you to more misery.
Mm.
And yeah, we got to get back to some common sense when we start talking about some of these things. Uh, you know what the most effective depression treatment is that ever existed
Mm.
in clinical studies?
Is it exercise?
It exercise is being a form of what's called behavioral activation. Okay. So if you take any form of what's called behavioral activation, which would generally for me, it includes some form of exercise, even if someone's been sedentary, it's just like walking, but taking care of responsibilities like in service of others and moving your body. If you do a randomized controlled clinical trial against any therapy, against any drug, that's always going to be the most effective depression treatment.
Hmm.
And so, as a cognitive behavioral psychologist, when someone becomes depressed, yes, we're still identifying all the factors that would lead to it, but I mean, we're developing behavioral activation between session because you got to get out of your head. It's your head that's making you miserable. I'm not going to let you sit in front of me and just continue to ruminate and direct all your attention onto everything that sucks in your life.
Yeah.
We got to get you out of this period of stagnation, and we have to use it to drive creative change. And so, like, yeah, moving your body, servicing others, getting out of your head is what drives recovery and improvement. It's not
Mhm.
staying there, just focused on yourself. And I think that's what happens in the mental health system. Unfortunately, now there's just like way too many people who are just stagnant, who see themselves as somewhat broken and like they need a therapist for the rest of their life.
Yeah. Yeah. It's about that action. It's always about that action. What are you going to do about it? Great. You have greater awareness. Cool. What are you going to do? Oh, you had a profound psychedelic experience. Cool. What are you going to do about it? You lost a loved one. What are you going to do about it? That it just it almost seems too simple, but it action leads to more action. Then the world opens up. You get little whispers from the universe that like support that action. You meet new people, new opportunities arise. That it's fundamental. Well, this was just what I hoped it would be. The conversation. I still have 1,000 other questions, but maybe I could circle back and do a part two on some of this stuff. I've got processes of feeling emotions and allowing them to move through you. I've got, mass shooters and psych meds, exercise and vitamin D, um, so many other things that I'd love to get into, but maybe we'll do a part two if you're up for it.
Sure.
Um, so before I ask the last question, which is a fill in the blank question that I ask each of my guests, where can people learn more and follow along if they're resonating with you?
Yeah, so you can go to drmcfillin.com, and that can get access to the Radically Genuine podcast. You can download that from any of your major apps. I'm writing on Substack, again, at drmcfillin.substack.com. I'm active on X at Dr. McFillin. I've started over the past year or so more active on Instagram. That's at Radically Genuine. So I'm available out there. I'm into the writing now. I think that's really important. Trying to build up the Substack. I can get some really key points to, for people to be able to follow actionable steps because I get so many questions, about these particular situations or what a doctor's recommending. So I do some consults also around the country, just helping to guide people. I also started a new nonprofit, the Conscious Clinician Collective, the CC Collective, or the the CCC, no, the CCcollective.org. You can go to that. Um, you can kind of read about what we're trying to do within the greater mental health system. It's kind of a new paradigm of care, trying to value informed consent and medical freedom. A lot of what is happening right now is that you go into a medical center and it's a quick screener or a quick diagnosis and leaving with a prescription drug, and those aren't the things that people need. And the entire kind of conceptualization and paradigm around mental health is driving pharmaceutical companies profits and not our well-being. And so trying to get a collective together of mental health and healthcare practitioners and those who are alternative healthcare practitioners kind of around the country who align with a similar belief system that exists on the cccollective.org website. It's a kind of a declaration. So I would ask people to to go there.
Excellent. Excellent. Easy to find. So this last fill in the blank question can be based on anything, however relevant in your life, and you can elaborate as much or as little as you wish, but please fill in the blank. Everyone would benefit from knowing.
That everything is happening for you and not to you. So I'll elaborate a little bit. I think this is a life changing mentality, and it protects you from any serious mental health problems the rest of your life. Because anything that is happening, as aversive as it is, as difficult as it is, if you shift the way you think about it as something to benefit you. Now, I'm a spiritual man, so I believe it's benefiting our soul expansion, and that's why we're here. But even if you're not as connected spiritually or religiously, to understand that there's great benefit to happening from that experience, that it's meant to happen, and you can grow from it. I've spoke here on this podcast today about the polarity that exists with the ups and downs. To view these things, these challenges, not as something that's happening to you, like you have bad luck or there's something broken about you, uh, but more of a transformational experience. And to even develop gratitude for the difficult times, because what can be created out of that can be uniquely special and life changing and meaningful. And it often is. If you look back throughout human history, what happens when we go through dark times in our collective humanity or individual struggles, it often drives uh, the creation and innovation of new ways of being and new ways of living. So it's a mentality shift. It's just like when I said, when you wake up in the morning, uh, do some gratitude practice. It's shifting a mindset, and now you're a creator. And remember, I believe this strongly, that we are creators of our own reality. So we're projecting onto the world what we are creating internally in your mind, and I want you to be able to cultivate that. So yes, there'll be struggles. We're going to accept those, but remember, you're a divine being. You're so resilient, and you're going to learn from what happened. Even my clients who've gone through unspeakable tragedies. I mean, there's some of the most wise people. The empathy that's been developed, the wisdom that's been developed, things they've created out of pain. And so it's a shift when the rest of the culture wants you sick and dependent. You know, we're going to be resilient and strong, and we're going to see life differently.
Hmm. Dr. McFillin, thank you for joining me today on the Optimal Performance Podcast.
Thank you, Sean.
Hmm.